Being a successful health coach isn't just about growing your client base. It's also about maintaining your own well being and preventing burnout. And in my experience, carving out an expert niche that will attract ideal clients and pairing that with a smart business plan is the key to create a successful practice that will make the difference that you know you're wanting to make. Once you know your niche, attracting clients becomes easier. It's about leveraging your strengths and expertise and offering valuable solutions for your ideal clients' health challenges. But here's the catch. Neglecting to find your niche will leave you spinning your wheels, not attracting clients, struggling to make ends meet, and burning out. That's the opposite of success. With the demand for health coaching on the rise, with the epidemic of chronic disease, with 50% of the population having at least one chronic disease that is consuming 86% of our healthcare expenditures, the time to act is now. So in this video, I'm going to show you how to carve out your expert niche that will attract that stream of ideal clients that can have you making the difference you know you're meant to make while preserving your own well-being so that you don't become one of those statistics. So if you like this video, be sure to like and subscribe so you will not miss out on any great content or any of our great interviews that we have here. So be sure to subscribe right now. And let's get into how do you carve out your expert niche. So what I teach is a specific kind of expert niche, and that is a PDEN, that stands for Purpose-Driven Expert Niche. So we want to look at those things that light you up, that you love to do, that quite frankly, you'd be interested in and help people with, even if they didn't pay you, but they will. So those are the things that if you're doing them all day, every day, you're going to love. So that's a great start to avoid burnout. Then on the other hand, what we want to look at is those areas that you have a track record in. What are you good at? What have you solved either personally, professionally? What do you have experience in bringing someone from point A problem to point B solution? And just open it up, brain dump all of it. And the intersection, when we look at all of those things that you love to do and all of those things that you're good at, that people are already asking for your help with, that gives you a head start. If people are already coming to ask you for advice, you're ahead of the game. So when we look at that intersection point between that purpose, the things that light you up, and that expertise, the intersection sweet spot is your purpose-driven expert niche. Okay, so that sounds good. How do we find that? So first off, look at, do you have a mission? Most people don't, but do you have a vision? Do you have things that, you just really care about? If you suddenly got a ton of money or a ton of time, what would you like to devote that to? I know health coaches are heart-centered. And what would you like to do? Is there a cause that is meaningful for you? Write that down. In fact, grab a piece of paper and pen right now and write this down as we go. So do you have something that is meaningful for you, that you have a vision and a mission for? Let's start there. Then let's look big picture. First, idea off the top of your head. Who would you like to serve? Who would you like to help? Sometimes you already have a ballpark idea. Menopause, weight loss, gut health, Crohn's disease, something like that. Sometimes you already have a ballpark idea. Let's write that down. Now, next I'm going to walk you through a very high-level version of this story gold mining process that I walk my clients through when we're trying to extract their genius to carve out their purpose-driven expert niche. So here are some things to consider. In your life, there will have been turning point moments. You cannot be an adult without having some rock bottom, pivotal turning point moments. So what was that rock bottom moment for you? Maybe it was a divorce. Maybe it was a diagnosis. Maybe it was a death in the family. What was it that all of a sudden you're going in this direction and then you're like, whoa, we got to change things? So, what was that? Now, if you had a particular health challenge, most health coaches who have a particular health challenge and then overcome that health challenge, that's a really great starting spot. But not everybody does. Sometimes you're like me, and I was a medical doctor for 25 years. So I could help people with lots of things. So you might have experience with lots of things, either personally or professionally, or you might have had a lot of health challenges and you could help with a variety of things. So it's not always there, but it's something to consider. So what are those rock bottom? And I want you to just now, if there's more than one, just jot the heading down of what the event is just for the moment. And I want you to take the one that kind of leaps out at you as the most meaningful. And I want you to ask yourself, what happened? What was that event? How old were you when this happened, when this started to happen? Were you married? Were you single? Did you have children? And what occupation did you do? Were you working? Were you not? What were you doing? Where were you living? Let's get the demographic of where you were before. And bring yourself right back to that moment. And if you had to formulate that in terms of a question, what was the biggest challenge that you had? If somebody said, waving the fairy godmother wand here, what wish do you have? What is the problem that you want solved? What is the thing that is preventing you from sleeping at night? What is that question? And is it like, how can I lose 50 pounds? Is it like, how can I get my energy back? Is it like, how can I not have to have surgery on my gut? How can I trust myself that I can go out and make plans for a social event without getting IBS or migraines or, a Crohn's flare? What was the thing that you had a problem with? And then what shifted? Because this has to be something that you've gotten on the other side of. You might be in a rock bottom moment right now. We're not going to go there. This is not something, we don't want to be the blind leading the blind. You don't want to be, hey, I'm struggling to create a health coaching practice. I think I'll help people create a health coaching practice because I can't figure it out. Don't do that. There are occasionally people who try to do that. That's obviously not a good idea. This rock bottom moment is now something that you are on the other side of. Turning point. Now, you don't have to be all the way there. Maybe you had 200 pounds to lose and you've lost 100, but you still have 100 left to go. That can work. So you don't have to be all the way there, but you have to have made significant strides. We're all human. We're all, going up and down in our health challenges here and there. Nobody's perfect. I'm not, you're not. But you have to have made significant progress from point A to point B in order for this to be something that you lead people through. So what is that? So what was the thing? What were some of the things that you tried to do? Was there a diet? Was there pills? Was there surgery? Was there specialists? Was there exercises? What were all the things that you tried to do to get on the other side of it? All right, now let's look at what was that ultimate, this worked. Finally, if you might have tried a bunch of things and you might not even know which one of those things, but what was the constellation of things that worked, and write all those down. So what helped and then what didn't help at all? Crash dieting, that didn't help. That made me yo-yo back. What helped? Was it that when you loved yourself? Now we'll put some of those things in there. That could be it. When you started to not abuse your body? Was it when you started to prioritize sleep or stress relief? Was it when you focused on gut health? Was it when you did a specific diet shift? What was the change that you did that all of a sudden turned everything around? Write that down. Write that down. So we've got the issue, who we were before, the problem constellation of problems, and there could be more than one. It could be bloating, it could be weight gain, it could be acne, it could be, all sorts of things, hot flashes. And then on the other side of it, was there a naturopath or a diet or a book you read or something that you did or a meditation? What was kind of that turning point? And then what is the result now? What is the result now? So you lost 50 pounds, your skin is glowing, your hair grew back. What were the things that your relationships were better, your energy was better, you weren't falling asleep on the way home from work? What were the things? Just make a list of all those things after. And now take a look at that. And that's like the initial starting spot of that. And that's that turning point moment. Now, let's do two more pieces of this. I want you to put a list of things that you are good at, that people say that you're good at. And these could be all about something totally different. Just really think outside the box. What things do people keep coming and asking for your advice on? So write those down. Interestingly enough, while I was a health coach myself, I kept having people asking for assistance on how to become a health coach. Still, that wasn't enough to be able to turn and pivot over. I did give them tips, but I never was looking to help health coaches with their practice. I was focused on my health coaching practice for many years, following being a medical doctor for 25 years. My focus was always helping people with their health. But it was this incredible day where I realized that there were so many health coaches. And in fact, while I was writing this book, I realized there was health coaches out there that were struggling to find clients. And I knew exactly how that felt because I was the same way. Medical doctor, radiologist, top of my game, all the alphabet super credentials, huge waiting lists of patients. But what I saw in the hospital, I realized 70% of everything I imaged in the hospital could have been prevented with a healthy lifestyle. And in the same time, I'd had 4 kids in 5 years, and I had gained 30 pounds. I mean, after each child, I lost all but 5 pounds, pretty good, but times 4 kids, that's 20 pounds plus 10 from high school. It's 30 pounds. It's how it's happened. And I realized that with the stress of my medical practice, and we were just pinballing people from test to test to test to test to test to test, and then go, sorry, nothing more we can do for you. And I realized that at least 70% of everything I imaged could have been prevented with a healthy lifestyle. And I was no longer satisfied with being the official photographer of disease and destruction. It was painful to see these people knowing that this suffering did not need to be that way. But in the fast-paced go, go, go of the medical system, you don't have time to do that. And it is kind of really late in the game now. So that was painful. But then I had to take a look in the mirror and look at, hey, I'm not sleeping. I'm stressed out. My nutrition's awful, running ragged, working over 100 hours a week, 1 week. Like, it's crazy, crazy. And with 4 little kids. And so that had me look into health coaching. And a late night desperate web search led me both to Deepak Chopra and IIN, Institute for Integrative Nutrition. And I'm like, oh my goodness, they're speaking my language. And I'd already at this point had just lost my 30 pounds, focusing on cleaning up my diet and superfoods. I just was super enamored with superfoods. And I'm like, I got to help people do this. This could really help. And so I went to IIN, became a health coach. And then even though I had all the credentials, even though I knew I could help people, I could walk people through what I had done, even though I had a waiting list a mile long of patients, as a health coach, same person, where is everybody? And that's when I realized, ugh, I thought I was just going holistic. I didn't realize I'd just become an entrepreneur. Oh, I didn't want to be an entrepreneur. I'm a doctor. I'm a healer. If I'd have wanted to go into business like my brothers, I'd have gone into business. But here I was. And so fast forward over a decade later, And now I did figure it out. 100 grand later, and trial and error, and many years later, I did figure it out. I did become a six-figure health coach, but it was not easy. And most people absolutely, without a doubt, would have quit before they got to that level. But for me, it really mattered. And honestly, I can't even explain why it really mattered. But ever since I was 14 and my grandma died of cancer, I didn't want to see anyone go through that. And that initially led me to medicine. But I'm like, people could be doing more to impact their health rather than giving their power away to me, the doctor, to fix them. When at that point, there's a lot they could have done to prevent that situation. Not every situation, but a lot. The medical system, excellent in an acute crisis. You know, if I break my arm, yeah, sure, bring the edges back together. I super appreciate that. Although technically, it's the body that is the miracle that heals itself. But uh, but I'm going to appreciate that. But for the overwhelming majority of chronic diseases, which is crippling our countries, these could largely have been prevented. So I knew I could make a difference, but I wasn't having these people. I see these health coaches now who have accomplished amazing things. They've reversed their diabetes. They've got out of an MS wheelchair. It's phenomenal. And yet, most of them did not have paying clients because they were like I was. They were a healer. They didn't realize they'd just become an entrepreneur. And they wanted to help everybody with everything, just like I did. And yet they were helping nobody with nothing. So that's when I started to really realize how important it was to have a niche, how important it was to articulate what you do. And also, especially if you're, you can help a few people and have some sort of a practice without a smart business plan. But if you want to replace a medical income like I had to do as the sole income earner for our family of six, I couldn't just quit my medical practice. We would starve under a bridge. So somehow I had to bridge that gap with no time. I had to create a six-figure health coaching practice while working 100-hour plus a week and having 4 little kids and really having no time to get this off the ground. Now, the good thing is I made every mistake there could be. So now I know the proven path, and I know the things that really work and the things that people tell you and regurgitate that work that you don't actually need to do or that aren't actually it. Things like websites. Now you'll have a website. I have a website, but that is not where you start. That is not how you attract clients. And especially, how can you have a website if you don't have a niche yet? What are you going to say? And just telling people that you're a health coach is not going to cut it. I was at an event in LA a couple of weeks ago, and I was letting them know that I help health coaches create successful six-figure health coaching practices, soul-satisfying health coaching practices without burning out. And as I shared this, it was immediately evident by the glazed look. People had no idea. Still, to this day, I've been in the health coach world so much for the last several years that people out there, they still have no idea what a health coach does. Someday we're going to change that. I'm on a mission to change that. I see a vision where everybody has a health coach. It's just the way it is. Every doctor refers, to a health coach to implement the daily practice so that their patients get the best care, the best results. I see a vision way in the future where that happens. Just like most people have a hairdresser, most people have a doctor, most people have those sort of things in their life. I see a day when most people have an accountant. I see a day when most people have a health coach. It's the same thing. But right now, they don't know what the heck you are. I had somebody say, "You mean like exercise?" That's what they said. "You mean like exercise?" So I had to readjust how I said it to this particular group. And so you will find that if you say, "I help people be healthy," or "I'm a health coach," they'll say, "Good." That's not going to cut it. So we have to narrow it down. Plus, nobody can be expert at everything. So one of the biggest things that I see with new health coaches, they have no clients. They really want to help people. They know what they did themselves, but they lack confidence. It's one of the common things. They lack confidence. So if you go, here I am, world, I'm going to help you with whatever health problems you have. Well, you have every right to feel not confident. Of course, you're not going to feel confident. Gosh, golly, who knows what's coming your way? You don't know what's coming your way. However, if you make a teeny tiny door and you stay in your lane, you stay in your scope of practice, you carve out your expertise and you work to become the world's leading expert. I am not kidding just a little bit, not even a little bit. If you work to become the world's leading expert in this tiny little niche, wow, people will come from miles around. I saw that in my medical practice. Over the years, I had a variety of areas in one of the hospitals that I worked at in Winnipeg, Manitoba. We, in our ultrasound department, I did a lot of thyroid ultrasounds. I was also give grand rounds. We'd go visiting. We had our telemedicine, teleradiology was we would do presentations to the rest of the province and, Western Ontario. And we were looking at topics and I thought, thyroid, a lot of people are not doing thyroid well. And we know the basics, we know enough to pass the test, but I was already starting to see Hashimoto's thyroiditis on the rise like crazy, and it's continuing to increase. And I'm like, we could be doing better with these thyroid ultrasounds, and I knew other people would as well. So I dove into the literature. I'm like, somebody got to know something about this. And I did a talk on the algorithm of how do you sort out what is okay, what is not, what are some of the features, and we went through that and I gave that talk. And after that, I started to get more people referring thyroid ultrasound. So that specific talk, that all of a sudden I'm doing a ton of thyroid ultrasounds. We got to add extra time in. Now they're getting referred from all over the city, then all over the province. So you become that center of excellence. When I was working in Calgary, we had a clinic, and one of the things that we did was injections of Morton's neuromas. Those are a little tiny tumor between the toes. And we were getting some really great results, but it was very unique and specialized. Most people don't even do that under ultrasound, but we had this particular tiny high frequency probe and so on. And when you carve out something specific and you're good at it and you get results, word gets out. And we had people come from Victoria, BC and fly to our clinic to get this treatment. And there's no advertising, there's no commercials, there's no Facebook ads, it's word of mouth. One of our six-figure health coaches, she carved out her niche, gut health, weight loss, busy mom. She had 5 kids, and she lives in a teeny tiny town in Montana. And she had a client fly from New York to her teeny tiny town in Montana, population, I think like 1,200, to see her. No paid advertising. No paid advertising. No Facebook ads. None of that. So when you are good at what you do, and you can't be good at everything, but when you are excellent at what you do and you get results, word gets out and people will come from miles around. That is such a win-win. Because don't you like to be good at what you do? Don't you want to be the good one? Don't you want to be the one that people talk about? Oh, if you want those results, you got to go to that person. Don't you want to be that person? Be that person. I always tell our clients, excellence is our strategy. Excellence is our strategy and our philosophy at the Health Professional Academy. Excellence is our strategy. So, but you can't be expert at everything, but you can be expert at one thing. And then you want to get a teeny tiny little niche and anoint yourself queen or king of that mountain and own it and then do it. And you know what happens when you do it over and over again? You get even better at it. And well, I'll tell you about an interesting thing that happens, but don't be afraid to be super narrow. Really, don't be afraid. However, be willing to take on anybody you want to. So one of our clients, she helps nurses with cervical dystonia. All right. So she's the only one I know who does that. And she has a thriving practice. And we haven't been working with each other for a year yet, but she is definitely well on track to six figures. So most people would say, oh no, I'm not going to narrow it down that much. Oh yes, you should narrow it down because we started off, she started off more general, and then we went back to the story, that same process that I started to have you go through with the rock bottom moment. And then it's like the universe gave her a nod. So as she was thinking about it, and I'm like, do it, Liz, do it. At that same time, there was a nurse with cervical dystonia in ICU. And she's like, that she became aware of. And she's like, yeah, I'm doing it. And so now she can help nurses and non-nurses with cervical dystonia. She can help people, nurses without cervical dystonia. She can help people with getting their energy back. She can help people with getting out of pain. She can help people with all sorts of things, just like she wanted to do at the beginning. Just like you want to help everybody with everything, this is how you do it. But you got to have that narrow niche that attracts the stream. And then when presented with people, and it will happen all the time, you can help whoever you darn well please. If you can help them and they want your help and you know how to help them and you want to help them, then by all means, help them. So the niche is just to attract people and you have a specialty, but you will help more than this one particular, and I like people to bring one particular ideal client avatar and really love that person. You'll do anything for that person. Everything is in service to your ideal client. And then the magic changes. So Tim was one of our very first clients, and he helped single diabetic dads know what to eat and what to do to balance their blood sugar so they could be a great role model for their kids. Now that sounds pretty specific, but think about it. He's a single diabetic dad and he's divorced. So he's now got his kids half time. If he's diabetic and he's got extra weight, probably his meal habits are not the best, potentially. And now he's got his kids and he's trying to be a good role model for them. And so this ideal client avatar, they might not have had to ever cook before. And now they got to be doing the cooking. And now they got to be doing the feeding of the kids. And they don't want their children to be following, his children to be following in those same unhealthy footsteps. So as Tim went out there with that niche, you know what happens? He's at the gym and somebody says, I'm not a dad, but can I come in? I got diabetes. I need to lose weight. There's a single mom. I'm not a dad, but I'm a mom. Can I come in? Somebody says, I'm not diabetic, but I want to lose weight. Can I come into your program? And that's how it works. The way to attract many is through the one. But if you say, I'll help you with whatever you want help with, you want help with your energy, you want help with your weight loss, you want help with your foot pain, you want help with your headaches, you want help with your skin, you want help with your menstrual cycles, you want help with your, you need help with babysitting your kids, you want me to walk your dog, you want me to paint your house, you want me to wash your windows, they're not coming. They're not coming. Be specific, narrow the niche. Because when you narrow the niche, you know what you're doing, you're confident, you start to see a pattern, you get better and better at it, and you're always going to work to be better at it, and then you deliver excellent results. And when you do excellent results, word gets out. One of my clients, Sherry, she had one of her clients get excellent results. This woman was at a funeral, and her friend says, oh my goodness, what did you do? You look amazing. And the woman said, Sherry Fullerman. That's the name of my client. And that client referred 10 more clients to my client, Sherry. Isn't that incredible? So when you get great results, your clients are walking, talking billboards. Your clients tend to know other people with that same condition. People with Crohn's know other people with Crohn's. People with MS know other people with MS. People with fibromyalgia tend to know people with fibromyalgia. You find somebody who can actually move the needle on this horrible problem. Now we're in business. Now we're in business. So carving out a niche is important. You want to think about the things that you're good at. You want to think about the things that you love to do, and really just spend some time looking at that. This is what we work on. You'll already get in the ballpark, and then we want to, I always say it's like carving it out, chiseling it out, sculpting it into place. So just keep narrowing and refining it, and really get the qualities of that person. Who is that person? And what is the demographic? How old are they? Where do they live? What do they do for a living? What other associated problems do they have? What other associated dreams do they have? Now that they're retired, they want to travel, but they can't because of their knee pain. Really look at who is that person and be the champion for that person. Now, I've got a great thing that I'm just inspired to tell you about now. If you would like, we've helped so many health coaches reach 6 and even multiple 6 figures. On average, they work about 3 days a week. So it's not about burning out. We got to not burn out. If you burn out, you're not good. What good are you? You become the statistics that we're trying to prevent. So there's a few little things that we want to know, but if we're attracting clients, we're already starting to be on track. So attracting clients is important, but then you want to set up and structure a business plan. And that's a little bit unique. It depends on who you're serving. One of our clients helps horses with their gut health, so that's a little bit unique. But carving out that niche is the absolute first essential step. So what I'm going to do is, if you would like, now be patient with me because I don't have Autobots, robots working for me. It's me, okay? So be patient with me. But if you would like the exact module that I am using to teach my clients right now, and that I use to teach my 6 and multiple 6-figure clients how to carve out their purpose-driven expert niche, the exact training that I used, that we kind of just scratched the surface on. But if you want, I want the real thing, I want it, type in the word coach in the comments and I will send it to you. Now, here's the thing. I might be not immediate because I'm not a robot, and I am helping clients get amazing results. And so just be patient with me. Repeat, tag me again, or whatever it is. And if you happen to be seeing this video someplace other than on YouTube, well, get to YouTube, subscribe to my Dr. Shaunna YouTube channel, but also private message me, DM, whatever you need to do. Shaunna Menard, Dr. Shaunna, Shaunna, and find me, message me, comment below, and I will send that me. Comment coach, and I will send you that module. Okay, that is just huge, huge. Okay, so let's kind of recap. Carve out those things. Look at those things that you're expert at. Look at those things that you love to do. Go through the story. Get your first gestalt, we call it, that first idea of what niche is it. What's my first impression niche? Then when we dive in further, we ask some of those questions. Really look at, what do I have an expertise in? What do I want to work to become a world's leading expert in? Sometimes you may have overcome something like breast cancer, for example, but you've been there, done that, and you do not want to help people with that. I mean, you're like, dodged a bullet, but I don't even want to go and talk about the word again. That's not your niche. So some things are triggering for you. Or you might have said, that breast cancer was the best thing that ever happened to me. I used to be a people pleaser. I used to let people walk all over me. They took advantage of me. I didn't take care of myself. I was not even anywhere on my priority list. And now I prioritize my sleep, my energy. I say no when I mean no. And I am more fit, more healthy than I have ever been. And I have had two people who are in those exact scenarios. So one person absolutely could be a champion for other women going through breast cancer. The other one, we got to pick a different niche that they do like to do. Remember, it's something that you love to do, that you do even if they didn't pay it, because it's just so fun. You don't even know why you like to help people with this. But usually it's because you're sort of kind of good at it. So take a look at what those things are, write it down, and then pick an age. How old is this person? And give this person a certain, and it could be the age that you were when you went through it, or the age that somebody you helped went through it, or a composite of all the people that you've helped go through it. So put the age down. Get a list of maybe 3 problems or so that you would describe it. And if you can give it a name, like MS, diabetes, PCOS, weight loss, belly fat, IBS, give it a name, a big broad category. And then what was the thing that they were looking for, and why do they want it? Why is it that they wanted that result? Why do they want the energy back? Why do they want the weight loss back? Sounds crazy, but why? Because that helps to carve out your niche. They're a dog lover. They love to walk their dog, but they can't because their knees are sore. Then this starts to help you, because when you know exactly who you serve, the problem you solve, the dream come true that you deliver, now you know where to find them. So if you're looking to find women, well, there's 8 billion people on the planet. I don't know where to find women generically, but if you're looking for Mary Smith at 123 Apple Lane, you know exactly where she is and exactly where to find her. You know whether they're going to be at the gym, at the spa, at the Little League, at the church, at the synagogue. You know where to find them once you know who they are. So it starts with the niche, then becoming expert at it, which you can when it's a narrow niche, attracts the ideal client. And then we just need to set up a business plan that won't burn you out. But you can get started, make a meaningful difference. And if you're not wanting 6 figures, the business plan's not as important, but I'd say go for 6 figures. Why? Because then you can reinvest. And by 6 figures, it's, I've written these books in particular about health coaching, Free to Heal First, which kind of goes through some of the steps that I'm talking about. And you can also get these at drshaunna.com, by the way. I give these for free. But then the 6-figure health coach, the right at the beginning of the book, I say, it's not about the money, but you got to make enough money so that it's not about the money. And if you're making less than 6 figures and you're making a little bit of money, your health coaching practice and therefore your ideal clients' health results are vulnerable. Because if you're helping a few people, then, well, let's do the reverse. If you're making 6 figures and doing work you love, that you're good at, that's making a difference, and somebody comes and offers you're making 100,000 doing this, and you're comfortable doing what you love with who you love, how you love, it's awesome. And someone comes along and offers you $250,000 to do work you don't really like to do with people you're not really liking, and it's not aligned with you at all. But if you're not making 6 figures, if you're not making ends meet, you're going to do it. And your health coaching practice will never get off the ground. However, if you're making at least 100,000 doing this and being able to reinvest in your clients and make a difference and make an income, for most people, that's a number where they are comfortable and not vulnerable. So you're making 100,000, someone offers you $250,000 to do work you don't want to do, and you're making 100,000 doing work you love, you can say a very quick, no, thank you. That's why I say 6 figures. It's not about here, get your yacht, your caviar. That is not what I'm talking about. But it takes money to make money, and you're going to be reinvesting in tools and assistance and supports to help your clients. And it gets easier and easier as you go so that you're not burning out. And it's not actually harder to make 100,000 than it is to make 50,000 with the right business model. If you're trading time for money, if you're charging by the hour, okay, obviously that's not going to work. By the way, don't do that. Don't do that, because you just can't. I mean, if you're just wanting to help a couple of friends, okay, fair enough. This message is not for you. But if you want to make a six-figure practice that is soul satisfying, that won't burn you out, you can't charge by the hour. I've done the math. I've tried it. I tried it. I tried it. I tried it. It doesn't work. So we need a different business plan, which will be a subject for another video. So the bottom line is, if you do not have an expert niche carved out, you're going to struggle. You're going to feel lack of confidence because you're trying to help everybody with everything. Nobody's going to see you as an expert. You're not going to be able to deliver consistent expert results because you're kind of all over the place, and you will burn out. And then you become one of the statistics. You're going to spin your wheels. You're going to struggle. I want to avoid that for you, because the world needs your healing gifts now than ever. We have rising diabetes, heart disease, cancer, you name it. We need more of you on the front lines. The medical system is buckling. They can't keep up. With chronic disease, excellent in a acute crisis, but this chronic disease has become a real big crisis. And we have to look at the whole thing differently and get out ahead of it and help people install those healthy habits, take ownership of their own health, not, abdicate their health to somebody external. And you can be that guide on the side, as Joshua of IIN says, to help bring that person along with those healthy habits. So you play a pivotal role here. You can really transform healthcare and really make a huge global impact. Really, truly, more than you can possibly imagine. One last quick story. One of my health coaches near the beginning of when I started helping health coaches with their health. And back to Tim, I mentioned earlier, who helped the single diabetic dads. And Alex was one of our clients, and she was a nurse in the hospital. And she saw on the vascular ward, on the front lines, the effects of diabetes. And she had a man there who was obese, who'd lost one leg already and was about to get the second leg amputated. And he had little kids, and he'd been in the hospital for about a year. And the statistics say he will not be alive a year from now. And that is a huge, huge problem and lots of suffering. And it didn't need to be that way. And so Alex rightfully said to Tim, who sometimes you think, well, I'm helping balance her blood sugar, but am I really making that big of a difference? Yes. Let's not wait for it to get that far off track. As a health coach, you can play a huge role in people's lives. You can eliminate a lot of pain and suffering, but I do not want it to cost you and create pain and suffering for you. And that's why it is critical that we do this without burning out. I think Joshua's got a new book, Heal the Healer. If that's not the title, that's the sentiment. That'll also be a great thing to pick up and a worthwhile read. We have to structure this so that it is sustainable for you, so that you can make the healing difference that you are meant to make. So pop in the comments if you like this video. If you have other questions, please feel free to ask. And with that, remember, type in the word coach, and I will do my best to send that module to you right away, because the world needs you and your healing gifts. Be good for you.